Yeah, good morning, everyone. Welcome to South India Business Week, the Healthcare Day, and the session topic is like the revolutionizing healthcare, integrating the pain management and sport rehabilitation and wellness initiatives. Good morning, everyone. In this panel, we have Minal Chandra, Dr. Minal Chandra. He's from Inopia, like pain management center, and also we have Sneha Tiwari. She's a sports therapist with BCCI domestic women cricket team, and we also have Varishab. He's the founder of VR Health Co, and we also have Neha Chakraborty. She's the director of Human Resource GeBBS Healthcare Solutions. And we also have Dr. Manjula Kumari. She is a CEO and senior consultant for obesity and physical therapy, Varanaa Healthcare Research and Training Organization. Good morning, all. We are happy to have you on board now. So today's topic, you already know that. So we'll start with Minal Chandra. Minal Chandra, how does your center apply innovative approaches to the pain and improve the quality of life for patients?
Hello all. My center, Epione Pain Management Center, is South India's first multidisciplinary pain management center. So when you talk about innovative, I won't say that we have anything innovative, but what I will say is the innovation what we have done in our center is to stick with the basics. So we have patients coming to us with chronic pain, and then the what is the regular trend is you talk to the patient, then you go for MRI, CT scan, whatever finding is there in MRI, CT scan, and then you start treating the patient. But the most important thing what we have realized is most of the thing you will identify when you start talking to the patient. So the most basic thing in healthcare is a doctor patient relationship, and we are sticking to this. So because of this thing sticking to patient and doctor relationship, we come out to a lot of diagnosis. And especially when I'm dealing with chronic pain, they have all the psychological issues, they have occupational issues, they have social issues. If you don't address all those things, we are not going to give any relief. If patient has pain, I give them painkillers, I do some interventions, patient go back, that is not going to treat. So the basic of making a patient doctor relationship is very, very important. Second thing is follow up with the patient. It's not like my treatment is for 1 month, 2 months, and then patient is like gone and we are done with it. No, we build the relationship that whenever patient seeks help, patient should come to us, and we have to give whatever patient is asking for, whatever patient require at that time. So I think these two things, what we follow, the basic things, make us different from rest of the thing in healthcare that is happening. And like I said, we are the first one to innovate this regenerative therapy, plasma therapy, non-surgical treatment, and we have done almost like 35,000 patients we have treated without undergoing any surgery using regenerative therapy. Regenerative is very popular in Western countries, but in India we have a little less awareness. But we also hold India Book of Record for doing the maximum number of treatment. So our whole concept was talking to the patient, understanding the problem, understanding the basic aura around the patient, and then treat it. So this is how we have been following, and we are happy that we have huge around 50,000 happy patients with us. We have 3 centers operating in 3 major cities of south of India, in Chennai, Bangalore, and Hyderabad. And this is the innovation. But stick to the basic. Make a patient or doctor relationship. Listen to the patient. When you listen to the patient, half of the solution is gone.
Hey, you're on a mute, I think.
Yeah, I think like you can hear me now.
Yeah.
Yes. So it was a nice insight, Minal Chandra, and we have next Sneha Tiwari. She's an sports therapist who is working for BCCI. So, Sneha, can you tell me what are the specific challenges do the sports people or especially the women's sports face in the terms of sports related injuries and rehabilitation? How does you address these challenges?
Hello everyone, good afternoon.
Hello, hello.
This is Sneha Tiwari. I work with women's senior team for the state level, and I've been working since 5 years. And even I was a fitness educator, then I came to physiotherapist. So, what happens in the women's team? See, injury in sports, the injuries are part and parcel. So every day we come across lots of injuries. But yeah, challenges with the women's team is that lots of hormonal imbalance, what we see. And even if you see, the women's are psychological strong. So it's very easy to deal with the injuries. But the main problem comes near the rehab. We do the inpatient things. If there is any injuries, yeah, we have to have a urgency level more. So what happened? Any sports person, they want to get back in the sports as soon as possible. They can't take a setback. When there is a setback, it's definitely a comeback. But people, lots of cricketers, what happened when there's a setback, there's a fall due to the injury or anything. These people are demotivated and they feel that now it's an end of the career. It's not an end of the career. So any injury have maybe different injury, if it's minor or major, the time period is different. Definitely, if they go across with a good rehab. The main thing that I focus with the rehab is the psychological thing. If you don't prepare a player with the mindset, then you can't do a good rehab. So to make them to do a rehab, I go in the psychological terms. First, anyone should accept their injuries. If they don't accept the injuries, there is the fall back to me because they deny it. If I say
Yes.
you take ACL reconstruction, take 6 months to 7 months, but the player can't accept, ma'am, I can't give 6 months and 7 months, and I can't sit at home. You're not sitting at home. You're preparing well for your upcoming thing. You're doing the rehab. You're making your body strong. So it's very important. A player should understand what is a setback. Then they have to go forward for the coming back thing. This is the drawback what I see, and yeah, I face all the challenges. But now I go with the psychological thing. I make my player to understand there is no end of the career. Let's go back and move forward again.
Yeah, it was nice insight, Sneha. So, like, we are going to this next question from Manjula Kumari, ma'am. Ma'am, how does your care research and training organization address the growing epidemic of the obesity through physical therapy and lifestyle innovations?
Yeah, hi, good morning, everybody. I'm Dr. Vivi Manjula Kumari. There is some resound from somewhere. Uh, you are on mute, I think.
Everyone should be on mute.
Yeah, resound is there. The speech is not clear. Yeah, now it's fine. Still, I can hear something. Yeah. So, hi, everybody. Very good morning to everybody. I'm Dr. Vivi Manjula Kumari. I'm CEO of Varana's Healthcare Research and Training Organization, LLP. I've been working on obesity since 2004, and I have an experience of 19 years on this. And we all know the fact that obesity is currently termed as a globosity, which means it's a non communicable pandemic in the world. So, according to the statistics, WHO statistics, which was taken in 2016, there were around 1.9 people struggling with obesity, overweight, and amongst them, there are 650 people who are 650 billion people who are actually obese. So the count is increasing day by day, and we all know the fact that the obesity is because of the perfect imbalance between the work, the output, the workout we do, and the intake, the food intake we take. So based on this, everybody Am I audible? Yeah, thank you. Thank you. So, based on this, we have designed a program. I'm a physical therapist by profession and I'm a sports physio as Miss Sneha Tiwari. And I developed a concept called Comprehensive Approach in Conservative Management of Obesity, by which we have helped around 5,600 obese patients in a single clinic in a span of 5 years, 6 months. According to this, we take care of the comprehensive approach, a multidisciplinary approach, in fact, which includes a physician who gives the advice regarding what actually is going wrong with their hormones or general health conditions. When a person comes to us, when an obese person comes to us, we take the entire medical history of that particular person, like what was the past medical history, what is the present medical history, is he having any hormonal issues, or if that particular person is undergoing any kind of depression or other things, so what are all the medication they are using, everything will be taken into account, and then we will advise them to go through certain tests, such as like we have a Ziman software which gives us the body composition analysis and all, and we see the targeted areas in the body where we have to focus more, where the fat deposition is more, what kind of body they have, like body type and other things, fat deposition, like androgenic obesity is there, or something as such. We will get to a we will come to a conclusion that this particular person, with the complete knowledge about that particular person, a health background, everything we will take into account, and then if required, if that particular person is having any issues with the hormones, we refer them to the endocrinologist, and then with the support of everybody, we'll start doing the treatment. In our treatment, we mainly focus on physical activity, because in even in the obesity cases, if that particular person heavy morbid obese cases, if that particular person is posted to surgery, unless until a physiotherapist certifies that we have tried everything and this particular person is not responding, such as exercise and other electrotherapeutic modalities are not helping to this person, then only that particular person can be posted for obesity surgery, like gastric bypass or something else like that. So if that particular person comes to us, we try everything for him non surgically, and we are successful in treating 7,500 obese patients in a single clinic, without surgery, without pills, and without any crash diets. We just give them a normal diet which consists of balanced diet. They will be having what their customized diet, in which we will be including their choices also. But we control the portion of diet, that is like mindful eating is practiced in our clinic. So in this way we started helping people. In our clinic we'll be going ahead with physical activity and physiotherapeutics, such as EMS and MAT, that is non-surgical lipolysis procedures, such as using ultrasound, cryolipolysis, laser lipolysis, and also endermology techniques. With all these techniques, we reduce the fat content, subcutaneous fat in that particular person, thereby helping them to regain, to control the portions, and at the same time to control the obesity in that particular patient. So we will be treating the person for their obesity, and that too for the fat loss, not for the muscle loss or something else. We focus on the fat loss. It's a healthy weight loss procedure which has been approved by US FDA, and these things are practiced non-surgically, without any crash diets, and customized diet will be given to the patient. As Minal ma'am said, rapport with the patient is much important. Half of the problems will be solved when we start listening to them, their own story, their own perceptions, their own concerns. Then only we will gain the trust of that particular patient, and we can help them in their way. In this way, we also design the lifestyle modification. When once the overweight is lost or the obesity has been managed, that particular person might come back, rebounds to their original weight, if the lifestyle modification has not been practiced properly. So during the sessions with us, we take around 3 months to reduce 10 kgs of body weight, excess body weight, that too and in a healthy way we will be going ahead. So during this process we practice the lifestyle modification also, along with the counseling, and what kind of food they are taking, what kind of portion they are taking, are there all the ingredients involved in that, if they are suggested for any medication, are they taking those medicines regularly or not, are there any other health conditions propping up during this 3 months. Everything will be taken into account, and a complete holistic procedure will be given to a particular patient. So in this way we were successful, and we are addressing the global pandemic. In the sense, we have to say that it is a globicity. This is how Varnas is addressing its globicity. Thank you. You are on mute, I guess.
It was a great, insightful answer you gave, ma'am. Like next, we'll go for
Yeah.
Neena Chakraborty. Neena, ma'am, can you explain me how does your organization prioritize uh, employee health and well-being as a part of its organization culture and HR innovations?
Sure, Vijay. Thank you so much, and good morning, everyone. So I'm Neena Chakraborty. I am part of HR fraternity for the last 20 years. Currently, I'm working with an organization called GeBBS Healthcare, which is into revenue cycle management. Just to tell you about layman's language, this is a back office for the US hospitals, and we kind of connect with the insurance companies and collect the money on behalf of our providers. So that's the job we do. My organization, we typically hire Gen Zs, right? Which is people who have just completed the graduation and aged between 20 to 26, 27. Now, when I'm dealing with these kind of people, it is very difficult. What kind of health benefits am I providing it to them from a healthcare organization? Now, prioritizing employee health is a essential part of my organization culture, and we drive multiple HR initiatives. For example, there is a comprehensive benefit package that we give it to our employees. There is a work-life balance that we maintain to ensure that they do not stretch out, they don't burn out of the work pressure. There are different health programs that we run, like in the last 6 months, like we have done a dental camp, we have done mental health sessions for them, we have done activities in terms of checking their blood sugars. We've called a couple of hospitals to partner with us to ensure that the medical concepts are taken care of. Parallelly, we also work with the other organizations to ensure the wealth or the health of the employee is taken care in terms of their mental well-being. So there have been sessions, we have appointed some counselors, because these are Gen Zs and these are people who get involved into various aspects while they are coming to work, not just their operational work, but relationships, growing up in their careers, how they want to grow in their life. All that ambiguity questions comes in. So there is a sort of counselor which helps them to understand what they really want to achieve, and give them some sort of directions also. So these are a couple of activities that my organization we drive in terms of employee well-being. The leadership team focuses on most of these activities, I must say, because their buying is very important. We do very regular communication. Now, apart from this, why I am close to the healthcare industries, I did work with the organization called Yashoda Group of Hospitals for 5.5 years, heading their HR. So I understand the importance of healthcare and why certain employees stick on to the healthcare companies and make a career out of it rather than getting into another IT or ITES companies. So, promoting employee well-being is the lookout for my organization. We are about 1,800 odd people right now in Hyderabad. Globally, it is about 20,000 odd headcount organization, and we promote well-being as a part of their life cycle. Thank you, Vijay.
Thank you, ma'am. It was a great, insightful answer you gave. So next, we'll go with Varshab. Varshab, does you how does VR Health company promote holistic wellness and preventive healthcare leadership to empower individuals to take charge of their health?
Yeah, first of all, hi everyone. Good morning. This is Varishab. I am a sports nutritionist. I'm also an author and founder of the We Are Health company. Our company and me as a founder, we run mentorship programs and nutrition counseling for people with lifestyle, metabolic, and hormonal issues, especially early age metabolic disorders, such as fatty liver, such as liver cirrhosis, such as PCOD, hormonal issues in women, and also sports rehabilitation. We usually promote integrative nutrition into our mentorship programs, in which we try to ensure that we are making people not only just lose weight, but also gain health side by side, and also help them fix certain lifestyle and metabolic disorders through integrative nutrition, keeping into mind their current weight, their current fat levels, and also their overall health. We ensure that we get a detailed blood analysis test done before working with any client, to ensure we are aware of what's happening inside their body and not just how they look and feel. We do a detailed analysis, and based on that, we create a nutrition counseling program for them, which lasts up to 3 to 6 months, depending upon the client requirements and how fast and slow their body responds. And based on that, we try to improve their health markers and their physique through our programs. Not only that, to spread awareness, we also run social media campaigns in which we promote our health strategies. And of course, majority of our clientele comes through social media, through my website, through Google, and our Instagram and Facebook. We're also very active on YouTube, wherein we create online content to create awareness and bring more value on the table. Recently, I have written a book, A Nutritionist in You, which is currently #1 bestseller on Amazon in our category, in which we have tried to promote sustainable dieting and holistic health through a process of writing a book. I'm someone who's very keen on writing and content creation, and I am a firm believer of modern science, and micromanaging everyone's health has become a priority right now, especially since COVID. The awareness is increasing day by day. And keeping up with our health and our weight is, I believe, no more a luxury, it's a necessity. Everyone should be aware of their health markers and keep up with their physique and health. And it's no more, I believe, it's no more a 2 month or a 3 month or a 6 month stint. It's a lifelong procedure. It's a lifelong procedure of taking care of your health and weight on a daily basis, doing something to keep yourself active, doing some sort of physical activity and exercise a day, and ensuring that you're following a healthy eating regime as well, which includes a balanced diet, as Ms. Manjula Kumari mentioned earlier, and other speakers as well. So not only a balanced diet, you need to look into your overall calorie intake, you need to look into your nutrition, micros, macros, and everything. And our company, as I mentioned, creates a training and nutrition programs, keeping that in mind.
Vaishab, thank you for the insightful answer you gave us. And we have also have joined Kavyachand. Kavyachand is like a CEO of Khavyaa Hospitals and Khavyaa Telehealth. So, Kavya, can you explain me like how was the telehealth transformed healthcare deliveries with Khavyaa Hospitals, and also what are the strategies has been effective in overcoming the challenges which are associated with the healthcare services?
Yeah, thank you, Vijay sir. So I'm Dr. Kavyachand, the Yalamudi, CEO Kavya Hospitals Khammam and Kavya Telehealth. So our major setup is in Khammam, and we operate it remotely to other areas as well. Our major services include endocrinology, diabetology, general medicine, dermatology, psychiatry. So these are the few issues which we can handle through telehealth. So we have majorly taken these branches, and what we have done is we have gone to remote areas. So nearby Khammam, we have many areas around Bhadrachalam, if you have heard. So there are many agency areas like Charla and Karakagudam. All these areas we have equipped. There is no specialist over there, frankly speaking, and they don't have access to good health. And there are many people who are dying with glycemic. I mean, the sugar level is very high, and BP is very high. Stroke cases were very high. So all these people are suffering because of there is no good quality health care in reach to those people. So what we have done is through Kavya Telehealth. Initially, Kavya Telehealth was started to help the COVID patients. So initially during COVID pandemic, we started it and we served around 200 patients per day. In 24 hours, we gave telehealth services to around 200 patients every day, along with medicine. And we have done this. It started in 2020 during the first wave, and we continued in 2021 as well. And even now, we are in touch with those patients, and we are also responsible for controlling the sugars as well, BP, thyroid, whatever issues. We are taking care of those patients by maintaining a follow-up. So mainly we concentrated more on the remote areas of Telangana, and we spread our wings over there. And whoever is having any problem like any general diseases, metabolic disorders, we have traced them and accordingly treat it with the telehealth. That's what we have done. And there are a lot of dermatology cases, psychiatric cases, and even mental health issues were more concerned from COVID pandemic. It has increased drastically when you see all over India also. What we have done is we have set up a mental health program through Kavya Hospital and Kavya Telehealth initiatives. And even we regularly set up camps in those areas and serve, we usually serve almost 10 lakh people per month. So this is our agenda right now. And we are also planning to shift to other areas. Right now we are we are only part of around Khammam, Bhadrachalam, till Kerala we covered these areas only. We are planning to expand it throughout Telangana, Andhra Pradesh, as well in other branches, in other states as well. So our main motto is to see for a diabetic-free India, because we know that diabetes is a major factor for India has become the diabetes capital. So what we are aiming at is to reduce the cases of diabetics, and also we are concentrating on preventive wellness also. Prevention is better than cure, as we all know. So we are mainly teaching them the lifestyle changes, as all of them has nicely explained. We are also telling them how to maintain their lifestyle, dietary practices. We are also giving the holistic approach to the patient through telehealth. So definitely telehealth has transformed the way the healthcare is proceeding these days, because through just a call, we can see how the patient is. And the satisfaction when the doctor sees the patient is immense. And I have seen it in many cases. And they usually get the sugars done, and they usually communicate with us, and they get their BP checkup done. And regular checkups have become part of, we have made regular checkups part of their schedule, and they're like following it because they were not aware of what was happening before. After we started our initiative only, they got to know, and we reached most of the remote areas. So most of them are having like access to good health care through Kavya Hospital and Kavya Telehealth. Thank you.
Thank you so much. So again, we'll go to the Minal Chandra ma'am. So Minal Chandra ma'am, can you share insight of the role of multidisciplinary pain management techniques in addressing chronic pain conditions and promoting holistic healing?
Yeah, see, we all speakers here, we all are in the same page. We all are talking about multidisciplinary management. We all are talking about, like Dr. Kavya was telling about maintaining of sugars and all those things. Manjula mentioning about, obesity, and then we have other speakers talking the same thing. So lifestyle modification, maintaining a good medical condition, like diabetes. We all know that diabetes again is the source of so many conditions. But diabetes, like I am into pain medicine, so I see a lot of diabetic patients coming with frozen shoulder. So we have so many medical conditions, give us so many chronic pain conditions. The prevalence of chronic pain is almost like 30 to 40% in India. So in pain medicine we say that once in lifetime, either we are going through some kind of pain, or in future we will go through some kind of pain. So this is inevitable. So multidisciplinary has a very, very important role to play. Unless and until you have a good lifestyle, unless and until you maintain a good posture, you have good ergonomics, your work life balance is good, your dietary habits are good, then only we can have a good bone health. Then only we are in a position where we are keeping all our musculoskeletal structures, the bone, the muscles, the joints active, and the chances of patients going into chronic pain is very, very less. So, like initially also I was mentioning, it is very important to talk to the patient. When a patients of chronic pain come to us, so chronic pain is something which is more than like 3 months, 6 months, then we say it's chronic pain. So during this, we have seen patients coming with small muscle pain since last 10 years. Over this 10 years, not only the pain has increased, but they have gone through some kind of disturbance at their workplace, some kind of disturbance in their relationship, some kind of disturbance in their social activities. So all those things will be included when the patient is suffering with small pain, muscle trigger pain, a small shoulder pain, knee joint pain. So we have a lots of things that we need to be addressed. So unless and until we have a team, unless and until we are addressing the physical cause of the pain, unless and until we identify what is the reason for the pain, what is the extent of the pain, we are treating as a physician, then we have rehab specialists who understand what is the need, then we have a dietitian who understand that what needs to be done with their obesity, their weight control, then what are the occupational changes they need to do, then we have cognitive behavioral therapy. So this is the role of multidisciplinary system in maintaining a good environment, in maintaining a good aura around the patient. So unless and until we are doing it as a multidisciplinary approach, we are not going to treat patient completely, because chronic pain patients are not only suffering with pain, they have lots of other issues associated with them. So in our clinic, like I said, it's the first multidisciplinary pain management center where a group of physicians, we have orthopedicians, we have pain physicians, rehab specialists, we have occupational therapists, dietitians working together towards one patient, and then only we can reach to the result that we expect. Even doing all this, we can never expect 100% results, so we can never give 100% to the patient. But if we do like this, definitely we are going to achieve something better, and we will work together in a way that we give the environment to the patient, so that we are moving towards a pain-free society.
Glad you are in the session now, and we are knowing you more better than like what you are offering to your patients and clients. So next we go to Sneha Tiwari ma'am. So can you provide me some examples of effective programs or strategies implemented with BCCI women cricket team to optimize performance and prevent injuries?
Yeah, so yeah, see, the sports is different. Now you can see not only cricket, but we are having n number of sports. But the BCCI is we get a protocols from NCA, National Cricket Academy. So we have a protocol for all the states. So what happened whenever a player come inside, will never go directly near the coach. So once the player come inside, will meet the concerned physiotherapist. So we have a protocol, musculoskeletal screening for them, which takes place for the 2 days. So in that screening, we'll come to know what are the problems. It's just to for the injury prevention, or we just talk about the previous injury. We'll get a complete scenario of our patient, whether my player is fit, or it's at the average level, or it's still not ready for the skill session and all. So from there, I'll come to know the range of motions, muscle strength. Then we have few special tests where we'll come to know any niggles or the previous injury. Still my player is into that zone. There are more chances of again injury can happen. So next step, if I give a green signal saying that yeah, um, from my side this player is ready to go, then we have a poster analysis also. So what we are doing now, this poster analysis is not using any technology, but recently in our center we got a poster analysis technology where you can get all the angles. Like we we got MNC's company inside, and we are helping them for the musculoskeletal screening. So if you see lots of people, not only in sports, in MNCs, they have neck pain, back pain, shoulder pain, plantar fasciitis and all. So what we're doing, we are doing a posterior technology analysis where I'm coming to know what is the problem. See, in the sports, imbalance is there. Whether the player is fit or unfit, it doesn't matter. Imbalance is there because of using a dominating and non-dominating side. So what happened? The second step, my players will go near the trainer, because they should. We have to know their endurance capacity. We have to know cardio respiratory capacity and all. So we will be conducting them on cardio respiratory thing like endurance, 2 kilometers run or yo-yo test. Then after measuring that, we'll get to know where our player is standing. So with the trainer, I will be having a communication with the trainer and saying them, "Ki ma'am, this player is ready for the skill. Just let's push this player for the skill session." Third thing, the player will go near the coach. Unless the player doesn't cross all these segments, will never be allowed it for the skills. So we have a benchmark criteria for a player to enter into the state team and also for the NCA. And here, before the game, for the pacers, if you have an idea, the cricket consists of batter, pacers, the bowler, and the fielder. Here, in the bowling, the pacers have a high. They are very prone to the injuries. So before going to the intense game, every day morning we will be having again a testing. We have to test the muscle tightness, we have to test the range of motion. If I have come to know testing me that hamstring tightness is there, before the game I have to release that hamstring, and my player will go with the loading thing. Here in the sports, loading is very important. It's the physiotherapist and trainer job to say the coach ki my player can load this much, my player is not allowed to load more. So by doing this, we'll minimize the injuries. Then we have a sports nutritionist, very important role, because we have to manage their weights. When we go with the in season, we have seen our players having a different weight, and off season different weight. In season, what we can't force anyone, but we will be traveling continuously, and there is no proper diet food. We are on the junk for 2 months, 3 months, 4 months. So what we are doing, we are carrying our sports nutritionist with us. So we are making sure what she is saying, the chart, the hotel people should provide that. We are being on very strict on nutrition for them. And the player who is on the recovery, we recommend them to have a good protein food. So we are carrying a nutritionist for them, and for the psychological purpose also, we are carrying a psychologist with us, sports psychologist. As I say, it's all about the mind game. Physically we are doing much, but to control the injuries also, we need someone who trains their mind. Mindset matters in the game. So we carry a psychologist. So one coming inside first have to go near sports physiotherapist and have to follow everyone, and then we will send our player near the coach. And again the cycle repeat. From the coach, the player will come near the physiotherapist. So what happened in the sports? A fit report is given by the physiotherapist. If I say my player is very prone for this injury, and maybe she's not fit, then we will make sure that we are doing a rehab, we are doing a good recovery. We have n number of recoveries. We'll go with the pool session, aquatics, we'll go with the cryotherapies. So we have n number of recovery. So it's an important system where we have to go, and daily we have tests for them. NCA protocol is that daily you have to do a test and you have to come to know where your player is standing. So we'll work according to the protocols, and in our center also, it's mostly a sports and MNCs base. We are concentrating on more of MNCs. If you see, MNCs main negligence is what they are not going with the musculoskeletal screening. We are going with the laboratories. We are going with the testing, diabetes and all. But who is taking care of musculoskeletal screening? There are lots of neck pain, back pain, migraines, knee pains for the youngsters. because of their poster correction. So we are also going ahead with the poster corrections. We are inviting the MNC's employees. We are getting tie-ups and we are saying, ma'am, we are there to help you out. You take this session, and this all minimize your surgeries. It's a point where I'm seeing lots of youngsters, 35 years when they are going with the spine surgeries. They are going, lots of spine surgeries are happening. And even Dr. Minal, I have, yeah, just seen lots of epidural injections are going on, which is working great with the rehab. But we are the one who is pushing till the surgeries. We have a number of things. So the way we are working, what I'm working with the sports, I'm working same with the people with their lifestyle. The modification is very important, as Manjula ma'am told you. Obesity, it's all about the lifestyle. So same thing we are following in the sports also.
Thank you, ma'am. Thank you so much. So next we can also go to again to the Manjula ma'am. Manjula ma'am, can you provide me some examples of the successful weight management programs or interventions implemented by your organization that have resulted in scientific health improvements for the patients?
Definitely. I'll go ahead with discussing a case. A patient came to me who has been posted for a bariatric surgery. He was very young and he was around 20 years of age, and he was weighing around 160 kgs. It was morbid obesity, and he was about to go for bariatric surgery. And the doctor sent the patient to me to give the fitness certificate that he is fit to go for the surgery. I spoke to the doctor and I asked him to give me 3 months time, and I can show significant reduction in his excess body weight as well as in his fat levels also. Sorry. To that particular patient, he was very young, and we wanted to go ahead with the complete holistic procedure for that particular patient. So in sorry, in that aspect, we have started ruling out what are all the things which were contributing for this particular morbid obesity in that particular patient. See, we cannot isolate and say that this particular patient is obese just because he is eating more. We cannot isolate one particular reason for obesity. We have to know the root cause for obesity. There are a lot of factors which are contributing to the obesity, like hypothyroidism could be there, and he might be on some corticosteroids for some other health reasons, and all these things. We had to rule out all these things. Then only we could come to a conclusion that this particular person was using corticosteroids since long, like right from his childhood, because he was suffering from asthma attacks and all. So when we could rule out this, we actually suggested him to visit a pulmonologist. So pulmonologist actually helped him with certain other medication and regular inhalation therapies and nebulization and all. So in that way, we could address the root cause for that particular person's obesity. So this is what I say. This is what is called iceberg phenomenon in medicine. Like if we are seeing a symptom, it's not just a symptom. The contributors might be more than one thing. So we have to see what is submerged in the water. So we have to address the root cause. So this is, if you know the root cause, you will be successfully treating that particular patient. This is what we have observed in our clinical practice, and this holds good for everything, every clinical practice as well. So in this way, we addressed the root cause of that particular obesity in that particular person. So in this way, we started helping him. We used different protocols, like we have used EMS for him, along with 20 to 30 minutes slow cycling. We started with slow cycling. So in our thing, we started giving him physical activity also, mild to moderate level of activity, because as he was weighing around 160 kgs, he was unable to walk for at least 2 minutes. So we gave him non-weight bearing exercises, that is static cycling and all. We started with that. So he was doing mild to moderate exercises. He started with first 5 minutes, then he started increasing it. By the end of the third month, he was able to do around 20 minutes of mild to moderate exercise. So in these 3 months, we helped him with EMS, and cavylipolysis, cryolipolysis as well, and different other physiotherapeutic modalities which could really help him to lose the excess fat and as well as body weight. In these 3 months, we were successful to reduce around 20 kgs, which has been promised by the doctor after post bariatric surgery. This way, we helped him, and the sagging was also not there. So we were working with his skin tightening procedures also. Not only losing weight, as well as the skin tightening was also there. So in bariatric surgery, soon after the surgery, when the person is losing his weight, they will be kept on. Bariatric surgery is just nothing but forceful dieting. They will be able to take only 800 kilocalories of food and all. So in our surgery, we were giving in our procedure, we were giving him normal diet up to we were giving around 1500 kilocalories as such, and we were including more amount of fiber because we just wanted to do the biohacking of ghrelin, in that way regulating the ghrelin and leptin mechanism also. So in this aspect, our dietitian was also working along with us. It was a multidisciplinary team which actually made this person lose 20 kgs in 3 months without a surgery, and this way we could help him. That guy, he totally lost the hope of at least walking for 2 minutes or 3 minutes, and that guy started walking, doing his like a treadmill activity for 6 months post 3 months of this particular treatment, and he was able to do non weight bearing exercises such as static cycling and all for about 15 to 20 minutes non-stop without taking any breaks. So this way we have improved the quality of life of that particular patient, and soon after this 20 kgs have been lost, we have given some maintenance sessions for about 3 months, and then again we started with the weight loss sessions. When his weight has been stabilized at 140 kgs, he gained around 2 kgs post these weight loss sessions. He came back to us with 142 kgs, and again we started with our weight loss sessions, and we helped him to come to a weight of around 98 kgs, and his height was around 180 centimeters. So we could bring him to near normal state, yet he was 10 kgs excess. That also he was able to reduce by doing some physical activity, workouts and all. So now he is leading a very healthy life, and the doctor was also surprised by seeing this particular patient. So during this process, his willpower is more important. Continuous counseling sessions were more important. Lifestyle modification was more important. And this particular patient has been treated 5 years back, and that patient is still maintaining his weight. That is more important. This requires a lot of him to get to put his mind and soul into this particular weight loss program. So that needs psychological counseling, and which is done by the psychiatrist as well as the psychologist. So all these people, a multidisciplinary, holistic approach helped a patient, saved him from bariatric surgery, and now he is leading a life without surgery. This is how our organization helped people. We have transformed the lives of around 5,600 people without surgery. Lot more people came us with diabetes and pre-diabetic conditions. So reversal of diabetes was also possible in few of them. In few of them who were really into that. And we have to understand the fact that being obese being obese, a person is not well nourished. Even they have their nutritional deficiencies. So they have to be addressed right and when they are necessary. So a dietitian's role was very well, we could see the appreciable, significant role of a dietitian in the entire process of weight loss. So with all these, we could achieve this particular benchmark in
Next, we can
obesity
go to
treatment industry.
it been almost like 5 minutes more. Is it okay for three questions more? Is it okay for all of you? Yeah. So we'll go to Neena. Neena ma'am. Neena ma'am, can you explain me some insightful into the challenges faced by healthcare organization in managing human resource effectively, particularly in the context of COVID pandemic?
Well, in interest of time, I'll make it crisp. Of course, when COVID happened, I was part of Yashoda Hospitals. I was heading the HR for them, and it was very difficult to ensure that the employees come to work, especially the nurses, the paramedic staff. They were, especially the lockdown time, they were just not able to, not keen to come and work for the hospitals. It was very challenging for us as an HR function to promote an employee that they have to come, because though pandemic was there, lockdown was happening, the patients were still in the hospital, the treatments were still handling, right? We also see the economy wise, the supply chain of the entire dynamics, the demand and supply. So what happened when before COVID, a doctor of cardio or radiology would see more patients, right, when compared to a pulmonologist, and suddenly the other two specialty came down and pulmonology rose up to like 400 to 500 OPDs per day, which definitely we understood the demand in the market and how the demand for the doctors also increases. So this was again from a pulmonology department perspective, it was more focused to ensure that the primary doctor plus the team doctors, the nurses, they all come back to work and they are in the mainstream of the hospital, plus getting the PPE kits, arranging transportations for the employees to come to work, even though they did not want to come, but we had to push them because we needed that healthcare for the patients who were still active. As a part of support function, me and my team completely we worked. I mean, I remember the lockdown time when we were only the one who were going on the roads, literally, without any traffic and all that. So that was an experience to go through for a support function, which in from a medical field perspective, for us to gauge what are those critical aspects to ensure the continuity of the business. At the end of the business, the hospital has to run, and there were multiple dimensions that we have tapped upon ensuring the business works as usual.
Thank you so much. So we'll have a quick question for Varishab also. Varishab, can you explain me some examples of successful wellness programs or innovatives implemented by VR Health Co. and that had a positive impact on community health outcomes?
So I'll make it very quick. There are two things that we specialize in. One is our lifestyle optimization program, which as I explained earlier, is mostly around metabolic lifestyle, genetic, and early age hormonal disorders. We have a clientele in about 23 countries in which we are trying to treat early age patients who are going through hormonal and lifestyle issues. And that spans across not just Indians in other countries, but foreigners as well. So we take care of them on one-on-one basis. We have a panel of doctors in our team. We have 11 doctors, physicians, gynecologists, or orthopedicians, cardiologists, therapists, psychiatrists, endocrinologists. So we have a panel of 11 doctors who assess their health before onboarding someone, and then basis on all detailed tests we would create a program that will help them manage their weight and physique better by knowing their demographics, their food choices, where they belong, their family food environment, their history of eating, their relationship with food, and all of that. So panel of doctors take care of their health on our company's behalf. Second thing is very unique. I don't think anybody is doing it in India. We started this a year ago, wherein we are taking care of, we are into full-time celebrity health management. We are currently working with 11 prominent celebrities in Delhi and Mumbai and taking care of their health and physique full-time. I take care of a few myself, but for others, we provide a specialist who shadows them 24/7, 365 days and helps them with their nutrition, works with their chefs to ensure they're getting their food on time wherever they are in the world. If they are traveling, they're abroad, the specialist travels with them. They're on a shoot, the specialist travels with them to ensure they're getting their food on time, to ensure they're exercising, training wherever they are, because they are in an industry where looking good, being presentable, being fit, healthy, and fresh is super important. So we ensure that somebody is shadowing them 24/7 and also taking care of their medical needs. keeping up with their appointments with doctor, keeping up with their medications and all of that, and creating a program around that. So celebrity health management is something that has really grown for us in the last 1 year. As I mentioned, we are now working with 13 people and trying to expand our footprints further in Delhi and Bombay. So that is something very unique, and we are getting great feedback for the same, and we are hoping that we are going to expand our footprints further in the next few years as well.
So much. And the last question for Kavya ma'am. Kavya ma'am, what pace does Kavya Telehealth leverage technology to enhance patients' access to healthcare services? How does your telehealth exist in person care models within your organization?
Hello, yeah. So Kavya Telehealth and Kavya Hospitals, both in 3 points, I'll just let you know. So firstly, we focused majorly like on what issues are the most of the community is suffering from. So majorly, we mainly focused on diseases which are most of the communicable and non-communicable diseases. Non-communicable diseases included diabetes, hypertension, obesity, and any other hormonal disorders. And these are most common in Telangana, Andhra Pradesh, as well in other states as well. So in India, we know that India is a diabetes capital. So we focused more on the diabetes version. So what we did is we monitored with the telehealth. We could monitor the blood sugars of people even in remote areas. And what innovation we took is we introduced artificial intelligence in endocrinology and diabetes. So what we do with this is and after 1 month when we see, we'll check the patient blood sugar again, and accordingly we'll prepare a graph of the patient's blood sugars like over the 6 months period, and accordingly how the dose is going. All this we are preparing graphs so that at the end of the day we will be able to reduce the dosage of the medicine being taken. As well, we are helping through lifestyle modification, like we are advising for walking and taking a proper diet. All these we are making it essential. And Kavya Telehealth also focused on providing medicine on time to the patients. We are advising patients like 2 days prior only to the appointment to meet, so that we can give medicine on time. And there won't be, most of them, as you know, they will be like leaving the medicine. They use it for 10 days and stop. We are even monitoring whether the patient is getting medicine on time and whether the patient is taking medicine or not. So we are going to the grassroots level, and we are planning to expand Kavya hospitals in person. When the patient comes here, we are doing the same thing, like applying artificial intelligence. And this year we got the most innovative multi-specialty hospital of the year award also for the same thing. So we are planning to expand more into Telangana as well, Andhra Pradesh and other states. So this main focus is to provide affordable healthcare to all patients, even in the remote areas. As well, make non-communicable diseases like all patients disease-free in India. This is what our motto is. So non-communicable diseases are the basic threat to the society. So we need to stop them. We need to prevent them. So we are taking all these preventive measures as well, treatment measures also in this focus. So we are to revolutionize healthcare in this sector.
Thank you, ma'am. Thank you so much for your insightful answer, and thank you all for joining this moment. I hope like you have some good insightful session with between all of us. Thank you so much. Thank you very much.
Thank you.
Thank you very much.